All right, let's jump into this deep dive. We're taking a look at a sociology textbook chapter all about medical sociology. It's going way beyond just biology to see how society shapes how we think about health and illness. Get ready, it's pretty eye-opening.
Yeah, it's really amazing to see how much society influences not only our individual health, but entire healthcare systems all over the world.
I know, right? And it got me thinking, like, how differently the world reacted to Ebola back in 2014 compared to COVID-19 just a few years later. Ebola was, mostly contained to West Africa, but COVID-19, well, that impacted everyone everywhere, right?
It's true, and it's kind of fascinating that even though there were travel bans during both of those outbreaks, the global response to COVID-19 was just so much more, like, fragmented. Think about it. Some countries embraced masks and social distancing, while other countries, their leaders, they actively downplayed the risks. It really showed how much politics and social dynamics play into public health.
It does make you wonder, right? Did we really learn from Ebola? Here in the U.S., for instance, all those conflicting messages about masks and lockdowns, they really showed how social and political stuff can sometimes overshadow, like, the actual science.
Yeah, and it wasn't just the U.S. Think about the response of Brazil's president to medical advice. It had a really, really devastating impact. But beyond that immediate health crisis, it's important to remember that pandemics have these ripple effects that go way beyond just getting sick.
Oh, that's so true. It's like this cascade of consequences, right? Families separated, treatments are delayed, people struggle financially, kids miss out on education. I mean, it's hard to imagine any part of life that wasn't touched by COVID-19.
Absolutely. And it's super important to understand how all those impacts, how they vary depending on your social context, like access to resources and your support systems.
This is where this whole idea of medical sociology comes in, right? We're looking at health through this bigger, like, societal lens.
Exactly. Medical sociology is all about exploring the social and cultural dimensions of health and illness, going beyond just the biological stuff.
So instead of just viruses and vaccines, we're looking at, like, how doctor-patient relationships or healthcare costs and even cultural beliefs play a role.
Yeah, you got it. And honestly, one of those thought-provoking concepts in medical sociology is this idea of the social construction of health.
Okay, I gotta admit that sounds a little, I don't know, abstract. Break it down for me. What does that actually mean?
Well, it means that our understanding of health and illness, it isn't only determined by biology, it's also shaped by our culture, our society. Think about the stigma around certain diseases like mental illness or AIDS. That stigma, that's a social construct, and it impacts how people seek care, how they're treated by others.
That's a really good point. It's like there's this whole layer of, like, social meaning on top of the actual illness itself.
Right. And then there are illnesses that are considered contested, like chronic fatigue syndrome. Even medical professionals debate whether it's real or not, which leaves patients in a really tough spot.
It's like everyone's trying to figure out where the line is between, what's in your head versus a real biological issue. But that line, it might be different depending on your culture.
Exactly. And then you have the social construction of the illness experience itself, too. Two people with the same diagnosis. They can experience it in totally different ways, depending on how they perceive it, their background.
So it's not just about the disease itself. It's about how you, like, interpret it and cope with it, which can be super personal.
Yeah, for some people, a long-term illness makes their world feel smaller. But for others, it can lead them to find a new strength, or even a new sense of self. I mean, even tools like pain scales, they acknowledge that individual perception matters.
Thinking back to the pandemic, it's so clear how differently people reacted to the lockdowns and the news and all that. Some people, they thrived in that environment, and others really, really struggled.
Yeah, it really shows you how our social context and our personalities, they both play a role in shaping our health experiences. And speaking of social context, we can't forget about the social construction of medical knowledge itself.
Okay, now that one really makes me curious. How can medical knowledge, which is supposed to be objective and scientific, how can that be socially constructed?
Well, think about how our understanding of women's health has changed over time. At one point, doctors told pregnant women to avoid all sorts of activities that we consider totally normal now. Medical knowledge evolves, and that evolution, it often reflects social norms and values too.
So it's like even the facts we rely on in medicine are being filtered through a social lens. And speaking of filtering, our textbook brings up this whole thing about pinkwashing, which is, pretty relevant right now with October being Breast Cancer Awareness Month.
It is interesting, isn't it? Everywhere you look, there's pink. But that watchdog group, Breast Cancer Action, they're urging us to think before you pink. because sometimes companies use pink products just to boost their profits, without actually contributing that much to the fight against breast cancer.
Oh, yeah, there was that whole controversy with the Susan G. Komen Foundation partnering with KFC for Buckets for the Cure, which, I don't know, seemed kind of ironic, to say the least, fried chicken for a cancer fundraiser.
It definitely raised some eyebrows.
Mhm.
It does make you wonder, is raising awareness enough to justify partnering with companies whose products might actually be harmful to your health?
It makes you think, is all that pink really helping?
Uh,
Or is it just creating like this feel-good distraction? It's definitely made me more aware of where my money's going when I buy pink ribbon stuff.
It's true. Being a critical consumer is super important when it comes to these health causes. And when we start to look at healthcare globally, we see even more stark contrasts. Our textbook really highlighted the huge difference in healthcare challenges between like high-income and low-income countries.
It's almost like we're living in different worlds. Here in the US, we're worried about things like rising obesity and chronic diseases, while in a lot of low-income countries, people are just struggling to get basic things like clean water and sanitation.
Right. Social epidemiology actually examines how those social problems directly impact health outcomes. It's not just bad luck. It's about systemic issues that create these health disparities.
It's heartbreaking to think that in some countries, the under 5 mortality rate is like 11 times higher than in high-income countries. Really puts things in perspective.
It does. And even though the U.S. is considered a high-income country, our healthcare system, it's kind of a paradox. We have all this incredibly advanced technology, but it's not equally accessible to everyone.
Right, it's like this land of medical innovation, but millions of Americans are still uninsured or underinsured. I've known people who've put off going to the doctor simply because they couldn't afford it.
Yeah. Our system relies a lot on private insurance,
Mm.
which creates disparities based on your job, your income, and even with the Affordable Care Act, which was supposed to expand coverage and control costs. There are still tons of debates and challenges.
Obamacare definitely got people talking, that's for sure. Some people saw it as a step towards universal health care, and others were really critical of it.
Yeah, it really highlights how complex healthcare is in the U.S. And within all of this, there's this interesting trend of medicalization. It's like we're turning everyday experiences into medical conditions.
That is a really intriguing idea. I can see how it happens, though. It's like we have a pill for everything these days, but when does it go too far,
Well, think about pregnancy and childbirth. They're natural processes,
Yeah.
but they've become so medicalized
Yeah.
with all these interventions that might not always be necessary.
It's like we've medicalized something that's been happening naturally for, forever.
And then you have sleeplessness, the rise of insomnia diagnoses, and all those ads for sleep meds. It really shows you how we've medicalized sleep problems.
Oh, I know. Those ads are everywhere. Makes you wonder if we're over-medicalizing everyday struggles.
The pharmaceutical industry definitely plays a role in that. And it's important to be aware of how much they influence how we understand and treat certain conditions.
Yeah.
Then you have obesity, which is a super complex issue in itself.
On the one hand, we're becoming more aware of the social and economic factors that contribute to obesity, but then on the other hand, it's still so stigmatized.
Yeah, it's often seen as this personal failing rather than a complex condition with lots of different factors at play, and that stigma can lead to discrimination, impact your health care.
So we're still kind of grappling with this tension. We want to acknowledge the complexities of obesity while also, fighting these negative stereotypes. It seems like with every topic we talk about, we're peeling back another layer of this complex relationship between society and health.
And to help us unpack these complexities even further, we can look at it through the lens of the 3 major sociological perspectives: functionalism, conflict theory, and symbolic interactionism.
So each perspective offers a unique way of understanding health, illness, and healthcare. Let's start with functionalism. How does it view health?
Well, functionalism sees health as being, essential for society to function smoothly. When someone gets sick, it's seen as a disruption to that.
Like a little wrench in the gears of society.
Exactly. One prominent sociologist, Talcott Parsons, he came up with this idea of the sick role. Basically, when you're sick, you're temporarily excused from your normal responsibilities. But you're expected to see a doctor and work towards getting better.
Okay, so it's like a temporary timeout from your normal role, but only with a doctor's permission. But what about people who can't afford to take time off work, even when they are sick? Doesn't that kind of challenge this whole sick role idea?
That's a really good point. The sick role assumes a certain level of social support and resources that not everyone has.
Yeah.
And functionalism, it also recognizes that prolonged illness can weaken society. So there might be mechanisms to try to manage behavior related to being sick.
Now, how does conflict theory differ from this functionalist view?
Well, conflict theory really focuses on the power dynamics and inequalities in the healthcare system. They argue that capitalism, with its focus on profit, it leads to health becoming like a commodity.
So healthcare becomes something you buy and sell rather than a basic human right.
Exactly. Conflict theorists would say those with wealth and power have greater access to quality healthcare, which ends up perpetuating inequalities between different social groups.
Creating a system where your health outcomes are tied to your socioeconomic status.
And they also look at how factors like race, gender, and sexual orientation, they intersect with class to create even more complex layers of health disparities.
So it's not just about being rich or poor, it's about all these social categories that can affect your access to healthcare.
Right. Now, shifting gears to symbolic interactionism. This perspective really emphasizes how we create meaning around health and illness through our interactions with others.
So it's about how we interpret and understand health, based on our experiences and the symbols we attach to it.
Exactly. They would be interested in how we define illnesses, how we experience being sick, and how those definitions and experiences shape our behavior.
It reminds me of that discussion about the social construction of health. So symbolic interactionists would be interested in how we as individuals and as a society, how we kind of negotiate those meanings, right?
Yeah, they're fascinated by how meanings and interpretations can vary across cultures and individuals. And they also look at things like the medicalization of deviance, where certain behaviors, like alcoholism, are redefined as medical conditions.
Which brings us back to that whole conversation about over-medicalization. It's amazing how all these ideas are interconnected.
Yeah, it shows just how complex and multifaceted the relationship is between society and health.
You know, we've covered so much ground already, from pandemics and medicalization to disability and global healthcare systems, and we're just getting started. There's so much more to explore in part 2 of our deep dive. Welcome back to our deep dive looking into the social side of health and illness. It's amazing how much we've already talked about, and there's still so much to go.
You know, we were just talking about how some behaviors get redefined as medical conditions.
Yeah.
Symbolic interactionists are also really interested in the opposite process, like demedicalization, where something that was once a medical issue, it's not seen that way anymore.
That makes sense, like the pendulum swinging the other way. What's a good example of that demedicalization?
A classic example is homosexuality. It used to be listed as a mental disorder, but thankfully that's not the case anymore.
That's a really powerful example of how societal perceptions and medical knowledge can shift over time. Speaking of shifting perceptions, our textbook also mentioned ADHD.
Right, ADHD, or attention deficit hyperactivity disorder. It often gets associated with kids, but it can actually continue into adulthood, which creates a whole other set of challenges, both for individuals and for society as a whole.
It does seem like there's a lot of debate around ADHD these days, especially when it comes to diagnosing and treating it.
Yeah, there are concerns about overdiagnosis and overprescription of medication, especially for kids. It's tricky because you want to make sure people who need support are getting it, but you also don't want to over-medicalize what might just be normal kid behavior.
Yeah, it's a tough balance to strike, and it really makes you think about all those social factors that might be playing into these trends.
For sure, the sociological perspective encourages us to look at the role of the pharmaceutical industry, cultural expectations, all of that. It shapes our understanding of ADHD.
It's like we need to zoom out, look beyond the individual diagnosis, and consider that larger context. And speaking of the bigger picture, all this talk about social categories and health disparities, it really got me thinking about the whole topic of disability.
Disability as a broad term covers a ton of physical and mental impairments. And it's so important to remember that it's not just a medical category. It's a social one, too.
What do you mean by that?
Well, the World Health Organization, they actually distinguish between impairment, which refers to the actual physical limitations someone might have, and disability, which is more about the social limitations. Those are imposed by, societal attitudes and structures.
So someone might have a physical impairment that limits their mobility, but it's actually the lack of wheelchair ramps or discriminatory attitudes that create the disability.
Exactly. The social model of disability says it's not the impairment itself that disables a person. It's all those barriers they face in society.
That is such an important shift in thinking. It really highlights how much power society has in shaping the whole experience of disability.
And it reminds us that we can all play a role in creating a more inclusive and accessible society for people with disabilities. And speaking of inclusion, the Americans with Disabilities Act, or AD, it's been so important in protecting the rights of people with disabilities.
The ABA was huge. It prohibits discrimination based on disability. In so many areas of life, employment, transportation, public places.
Think about it. Wheelchair ramps, braille signage, accessible restrooms. We take these things for granted now, but they wouldn't be here without the ADA.
It's easy to forget all the progress that's been made, but it's also important to remember that stigma and discrimination, they still exist, especially for people with mental illnesses or intellectual disabilities.
Unfortunately, that's true. And that stigma can have such a real impact on people's lives. It can lead to social isolation, fewer opportunities, even internalized shame.
It reminds us that we still have a ways to go in creating a truly inclusive and equitable society for everyone. And when we look at healthcare on a global scale, those inequities become even more obvious. Our textbook contrasted the U.S. healthcare system with systems in other, developed countries.
Yeah, there are some really big differences in how healthcare is organized and delivered around the world.
You know, the U.S. system, it's often called market-based. Healthcare is treated like any other product, basically, which leads to some amazing innovations, but also high costs and unequal access.
That is one of the biggest criticisms of the U.S. system. Healthcare being seen as something you buy rather than a fundamental right.
It is interesting to compare that to systems like in Canada or lots of European countries, where healthcare is seen as this universal right, meaning everyone has access no matter if they can pay or not.
In those systems, the government plays a big role in funding and regulating healthcare, making sure everyone can get those essential medical services.
So it's like healthcare becomes a public good, similar to education or public transportation.
That's a good way to put it. Of course, there are different models of universal healthcare, each with their pros and cons. Canada's system, for example, is publicly funded but delivered by private providers, while the UK's National Health Service, the NHS, that's funded and run by the government.
So there's no one perfect solution. But the main idea is that everyone deserves access to healthcare without going bankrupt. It does make you wonder, why the U.S., with all its wealth and resources, why haven't we gone for a universal healthcare system?
That is a very complex question. There are a lot of historical, political, and economic pieces to that puzzle.
I bet there are some strong opinions on both sides of that debate.
Oh, absolutely. The debate over healthcare reform in the U.S. is ongoing, and it can get pretty heated.
Well, let's bring it back to the sociological perspectives for a second. We talked about how functionalism and conflict theory view healthcare. What about symbolic interactionism? How would they approach these different systems around the world?
They'd be fascinated by the meanings and symbols we attach to different healthcare systems and how those meanings are constructed and negotiated within societies.
So how terms like socialized medicine or universal healthcare, they can trigger really different reactions and emotions.
Exactly. They'd also look at how those healthcare interactions themselves, how they're shaped by cultural norms and power dynamics.
Yeah, like the doctor-patient relationship. It has all these inherent power imbalances and unspoken expectations that can really influence how people communicate and make decisions about their health.
It's important to remember that healthcare isn't just a technical process. It's deeply social, embedded in our beliefs and power structures.
As we wrap up this part of our deep dive, I'm really struck by how interconnected all of these issues are. It's not just about individual choices. It's about the social forces that shape our health and well-being.
That's such a key takeaway. Understanding that social side of health and illness, it's crucial if we want to address healthcare disparities, promote well-being, and ultimately create a more just and equitable world.
It really is. We've covered so much, from pandemics and medicalization to disability and global systems. I'm excited to see what else comes up in the final part of our deep dive.
Welcome back to our deep dive on health and illness, kind of looking at it through that sociology lens. We've been exploring this textbook chapter on medical sociology, and it's really got me thinking about how much society impacts every single part of health, from our own experiences to the whole healthcare system.
It's been quite a journey, hasn't it? We've covered pandemics, medicalization, disability, global healthcare disparities. It's a lot. But it's clear that understanding the social side of things, that's key to addressing these tough issues. And in this final part, I'm really excited to dig a little deeper, into some specific health challenges, exploring maybe some alternative approaches to healthcare, and even brainstorm in some ways we can all contribute to a healthier and more equitable world. Sounds like a plan. One thing that really jumped out at me in the textbook was the section on global health challenges, especially those numbers about the lack of basic health care. In so many low-income countries, it can feel overwhelming. What can we as individuals really do to make a difference on such a big issue?
That's a question a lot of people ask. And it's super important to remember that you're not powerless. There are a lot of ways we can contribute to positive change, both in our own communities and globally.
Give me some concrete examples. I'm all ears.
Well, one of the most direct ways to help is by supporting organizations that are working on the ground, providing health care, and advocating for health equity. Groups like Doctors Without Borders, UNICEF, the World Health Organization, they're doing amazing work, often in the most difficult situations around the world.
Yeah, donating to those groups, that's definitely something I can do. It's nice to know that even a little bit can help someone get basic health care.
Absolutely. And another powerful way to make a difference is by staying informed about global health issues and then using your voice to advocate for policies that address those problems.
So, like contacting our elected officials, urging them to support global health initiatives, talking about these issues in our communities.
Exactly. We can also be, mindful consumers, supporting companies that prioritize ethical and sustainable practices like fair labor standards and environmental stuff. Our choices when we buy things, they can make a difference. Encourage businesses to step up.
That's so true. Sometimes it feels like all we hear about is bad news. But it's good to remember there are things we can do, even small things. And together, they can help build a better future.
I agree. And it's not just about what we do globally. We can make a difference in our own backyards, too. There are tons of opportunities to volunteer your time or skills at local groups that address health disparities right here at home.
Volunteering, that's a great idea. I'm sure there are free clinics, food banks, or community health centers that would love the extra.
Yeah, for sure. And speaking of different approaches to health, our textbook mentioned traditional or complementary medicine. I'd love to hear your thoughts on the growing interest in these kinds of practices.
It's really interesting to see how different cultures approach health and healing. Traditional medicine, it often has this more holistic view, seeing the mind, body, and spirit as all connected.
That's a big contrast to the biomedical model that's dominant in Western medicine, which tends to focus on treating specific symptoms or diseases one at a time. Traditional medicine often focuses more on prevention and lifestyle changes to keep you well overall.
And while some people might still see traditional medicine as alternative or unconventional, it's important to remember that for millions of people around the world, that's their main source of healthcare.
Absolutely. And even in Western societies, we're seeing more acceptance of traditional and complementary medicine, like acupuncture and yoga. They're becoming more and more popular.
It seems like people are looking for that balance. Combining the scientific advancements of Western medicine with the wisdom of traditional practices.
It's an exciting shift, and I think it shows how people are becoming more aware of the limits of just a biomedical approach.
Well, as we wrap up this whole deep dive into medical sociology, I gotta say, this has been eye-opening. Definitely got me thinking. I feel like I have a whole new way of looking at how much society really shapes our health and well-being.
Me too, for sure. And I hope it's encouraged you to look at health and illness with like a more critical eye, thinking not just about the biological stuff, but all those social and cultural influences too.
It definitely has, and I think that's a perfect takeaway for our listeners. We've covered so much, but the biggest thing I'm taking away is that health. It's not just a personal thing. It's completely tied to the world around us.
That's such a great point. It reminds us that we all have a part to play in creating a healthier and more equitable society for everyone.
Thanks for joining us on this incredible journey into medical sociology. We hope you've enjoyed this deep dive and that it sparks some new ideas for you.
And we encourage you to keep exploring, keep asking those questions, and keep working towards a world where everyone has the chance to live a healthy and fulfilling life.